welcome to your last week in review of the course and the program. I would like to congratulate you on your presentations for the case study. You did very, very good with that, especially knowing that it was, for many of you, the first time that you've used something like that with the camera and you talking. And I know there were some technical difficulties for some of you with uploading slides. So I appreciate the feedback on that. We are looking at some different technologies. One of them is the one that you used, MoveNote. There's another one out there we'll be looking at and seeing which one is more error-free. None of them are going to be 100% all the time, but even with some of the glitches on missing slides, your presentations were very, very, very good. So excellent job with that, as well as your case study paper. That case study paper was done very, very well. So congratulate yourself on that. Excellent job. Now, I did promise you the big reveal on that case study, because if you remember earlier, I said that case study was based off of a real-life hospital. So what was that hospital? It was St. Anne's Mercy Hospital in Toledo, Ohio. Some of the things were changed a little bit. Location was changed. But bed size and some of the other things were pretty much spot on. Staff size, equipment size was pretty much what they have or what they had. But I know you're dying to know, what did they end up doing in real life? Well, they've actually have attempted or are working on most of those things that were in the case study. The first thing that they did was the women's health imaging. They do have a pretty extensive women's imaging department with of course, mammography. They've got DEXA, and they were doing quite a bit of MR breast imaging. That was kind of the new area. And because of that kind of that expertise, they were feeding in other hospitals within the system. That system was Mercy Health Partners in Northwest Ohio. They were feeding into that particular hospital as well. So that was kind of a nice situation in which other hospitals were having their patients come there for the imaging needs. The next thing that they looked at was the bariatric market. And that one has worked out to some extent. It hasn't been as big as the women's health imaging. It has definitely given access to larger patients. But here's what they did. The first thing they did is, when they had their cancer center, which there is a small cancer center also attached to the hospital, they decided to purchase a big bore CT. We can get some really large patients in that CT scanner. It's a Philips. That was their first phase. The second phase was their MR was coming off lease. So that magnet was going to come off of lease. And what they did, they took the wall out and brought in a big bore MR magnet. So really, that bariatric patient can be served there. With that, relatively recently, now they are doing some more bariatric surgery there as well, now that they've got the added capability of the imaging. So that has helped with, again, feeding into the system and bringing more profits and et cetera. And of course, addressing the needs of the market, which in most cases, patients are getting larger. The next thing, the thing that they didn't do here is the low dose CT scanner. They really haven't gone to the, they have not purchased the equipment CT wise, or the protocols that kind of go with the equipment to go the low dose route. Not to say that they're using inappropriate dosage, but it's just kind of the industry standard. I will say that our competition, because I work for that system, Mercy, and we're basically a two-system hospital town here. We have the Mercy system, and then we have another system called ProMedica. Our competition, which is probably maybe a quarter of the mile down the street, has a small imaging center. They did go with a low dose route, and they made full page ads in newspapers touting the wonders of their new low dose CT scanners. So I will say, even though this particular hospital didn't go that route, it is being played out in the market right now, going the low dose route. The other thing that they are attempting to do is the American College of Radiology accreditation. That has been kind of an ongoing off again, on again project, and right now, last I looked, it was still kind of on hold. Reason for that is, as you know, the dynamic nature of medical imaging, what's going on, especially right now in the past 2 years, with the Affordable Care Act and all of the changes. This particular department has been, at St. Anne's, has been affected with managerial changes. So I think right now that ACR accreditation is on hold. But it is something that they were working towards, and I believe it's still on the horizon for them to do. But kind of, they got bigger fish to fry. It's kind of what they have to worry about now, especially with the Affordable Care Act. So some of those priorities have been shifted as they brace for what may happen with the Affordable Care Act, and making sure the department is positioned to remain viable with the new payment model that is upon us. So basically, they did, out of those four, the one they really never went with is the low dose. But that doesn't mean there was no right or wrong answer for this case study. And that's really what we were looking at, is can you look at these things and support what you want to do with your decision. There isn't, again, no right or wrong, and doesn't mean this particular hospital, the real life scenario, they had all the right answers. I guess that will play out in the future as the business model changes, and to what is really the big question with the Affordable Care Act in the next couple of years. So that is the real life situation where the case study was based off. But again, all of you did a very, very good job with how you presented it and your reasoning behind that. And that was really the most important part of that. So again, very, very good job with that. Okay, now let's talk a little bit about this week. You only have one assignment, and that's that reflection paper. There's no requirements, no word count. I do ask that you do spend some time on it, though, maybe an hour to 45 minutes, just writing down, again, your thoughts. What did you think about coming into the program? As you progress through the program, who helped you along the way? Family, friends? I know some of you have had some significant challenges as you've gone through the program. How did you surmount those challenges? What advice would you give to a new student coming into the program? Now, that we do share with new students. When they come into the program, they take a little mini course, if you remember. All of you had to take that little mini course. That course has continued to evolve. But one of the things that we share with them are, here's what students have said as far as what they think is successful. And every time I ask that question, I'm always surprised about things that other students did to contribute to their success that weren't initially on our radar and are really valuable in sharing that with other people. So if you do have anything, please share that, and we'd be happy to pass that along to the next generation coming through. Again, this project or this paper is due by Tuesday at midnight, so please have that in. Grades will be due Wednesday. So, because of course all of you are graduating on Friday. And with that, I do want to congratulate you on your accomplishment. I know that it has been a tremendous challenge to get to this point. Late nights with a laptop, doing assignments, some assignments you liked, some assignments you dreaded. Some instructors you like, some where maybe you didn't like, but you persevered and you continued, and now you've graduated. I've talked to a couple of you this morning, and I know there's some very, very exciting things that are happening on the horizon for you, and I, again, wish all of you the very best as you go forward in your careers and your personal lives. If you do need anything from myself or the faculty members, please do not hesitate to contact us, because we're really here for your long-term success. Maybe you decide to go on to graduate school. I know a couple of you are going on to graduate school this fall. If you need any letters or references, letters of reference, please feel free to contact either myself or any of the faculty members that you've had along the way. Or if there's any other thing that we can help you with, don't hesitate to ask. I'll have to have students contact me about maybe graduate school. What kind of programs should I look at? Be happy to bounce around some ideas with you if you decide to go in that direction. So again, please don't hesitate to contact us for anything in the future. And again, congratulations on this accomplishment. It is truly a time to celebrate. Please take some time. I know we're all very, very busy, with this, and I hope that all of you can make it for graduation. But I know for logistics and getting off of work, for some of you that may not be possible. But please try to take some time this week or this weekend to celebrate, your accomplishment. It's a once-in-a-lifetime thing that people get a bachelor's degree. So do take some time to, again, celebrate your accomplishment. And again, if there's anything I can do in the future, please do not hesitate to contact me. And I wish you all the best.